Are you taking Cialis and dealing with side effects like headaches, a stuffy nose, or even blurry vision? Maybe you're wondering, how long does it take to work? What if it doesn't work at all? Or when is it unsafe to take? In this video, I'll cover everything you need to know about Cialis, how it affects your body, its side effects, and key safety tips. Whether you're just starting or already using it, stick around until the end for answers to the most common questions I get asked from my patients. Let's dive in and help you make an informed decision about taking it. So let's start at the beginning with what exactly is Cialis. Tadalafil is its generic or chemical name, and its brand names include Cialis or Adcirca. It's a medicine used to treat erection problems, sometimes called erectile dysfunction. It works by temporarily increasing blood flow to the penis when you get sexually excited. It also helps reduce symptoms of an enlarged prostate gland, sometimes called benign prostate enlargement or benign prostatic hyperplasia. This is when men experience difficulty peeing or needing to pee urgently, and it works by relaxing the muscles in the prostate and bladder. It's also used to treat pulmonary hypertension, which is a high blood pressure in the blood vessels that supply the lungs. It works by relaxing blood vessels in the chest, so this increases blood supply to the lungs and reduces the workload of the heart. Cialis can also be used to help manage severe chronic prostatitis, which is the inflammation of the prostate, because it helps with chronic pelvic pain syndrome, which is a complication of prostatitis. However, I won't be covering this in this video. So how does it work? Cialis belongs to a group of medicines called phosphodiesterase 5 inhibitors. These work by enhancing nitric oxide release, which increases blood flow into the penis, making an erection hard enough to have sex. So who can take Cialis? Most men aged 18 and over can take it for erectile dysfunction. Most adults aged 18 and over can take it for pulmonary hypertension, and this includes women. However, there's no good evidence that Cialis works for women with sexual problems. There are some concerns about the long-term effects that Cialis might have on the female body. So who may not be able to take Cialis? It's not suitable for some people. To make sure it's safe for you, tell your doctor if you have ever had an allergic reaction to Cialis or any other medicine. If you are taking medicines called nitrates for chest pain, if you have a serious heart or liver problem, if you have recently had a stroke or a heart attack, if you have low blood pressure or uncontrolled high blood pressure, if you have ever lost your vision due to reduced blood flow to the eye, if you have had a previous history of hearing loss, if you have sickle cell anemia, if you have leukemia, if you have multiple myeloma, if you have Peyronie's disease or a similar problem with your penis, if you have a liver or kidney condition, if you have a heart condition, your doctor will advise you whether your heart can take the additional strain of having sex. So what's the dose? Cialis comes as 2.5, 5, 10 and 20 mg tablets. The usual dose for erectile dysfunction is 10 mg when you need it, and remember not to take more than one tablet a day. This is because the effects may last longer than 24 hours. Cialis for an enlarged prostate comes as 2.5 or 5 mg tablets. The usual dose is 5 mg taken once a day. If you're being treated for both benign prostate enlargement and erectile dysfunction, the dose is 5 mg. Cialis for pulmonary hypertension comes as 20 mg tablets, and the usual dose is 40 mg, so you will have to take 2 20 mg tablets once a day. If you have kidney or liver problems, your doctor might decrease the starting dose to 10 or 20 mg. So how do you take it? Now swallow your tablets whole with a drink of water or juice, but not grapefruit juice. Try and avoid this. For erectile dysfunction, take 1 tablet at least 30 minutes before you want to have sex. If you are taking Cialis for prostate enlargement, you can take the tablet in the morning or evening, but it's best to take it at the same time each day. Cialis tablets for pulmonary hypertension are large and may be difficult to swallow. You can watch my video on tips on swallowing medication, which I will leave a link for down below. So how long before Cialis starts working? So it usually starts to work within 30 to 60 minutes. And if you're taking it for erectile dysfunction, it's triggered by sexual stimulation, so you need to be aroused for it to work. So what are the common side effects? Headaches, upset stomach or feeling sick, facial flushing and hot flushes, indigestion, a stuffy nose, or muscle aches. So what are the serious side effects? I would go to the emergency services if you have sudden loss of vision or sudden problems with your hearing. Stop taking Cialis if this happens. If you have a prolonged or painful erection, especially if it lasts more than 2 hours. In rare cases, Cialis can cause a serious allergic reaction. If you have a seizure or fit. And stop taking Cialis if you get symptoms such as chest pain during or after sex, and you usually use nitrates such as glyceryl trinitrate. Don't take them to treat your chest pain. Now, these are not all the side effects of Cialis. For a full list, see the leaflet inside your medicines packet. Now, what are the cautions with other medicines? Some medicines don't mix well with Cialis, so tell your doctor or pharmacist if you're taking these medicines before you start Cialis. Nitrates for chest pain, such as glyceryl trinitrate spray or tablets. Riociguat for pulmonary hypertension. Blood pressure medications such as doxazocin. Now, is it safe to take Cialis? Now, there aren't any long-term side effects or health problems, but keep in mind that you should only take 1 dose per 24 hours because its effect can last up to 36 hours. Your erection should go away after you have had sex. Cialis is not recommended if you've had a stroke or heart attack in the past 6 months, or if you have severely uncontrolled high blood pressure or severely low blood pressure or unstable angina. Now, what if Cialis doesn't work for erectile dysfunction? It usually works well for this, but if it doesn't work for you, it may be because you have not waited long enough after taking it before trying to have sex, or you have waited too long after taking it to have sex, or the dose isn't high enough, or you're not sexually aroused enough. I would have a discussion with your doctor who may then increase your dose. If Cialis still doesn't work, there are other tablets you could try that work in a similar way, such as sildenafil, avanafil, vardenafil. I will leave a link to a video about sildenafil, the brand name Viagra, if you would like to learn more about this medicine. And if you cannot get erections because of a hormonal problem, your doctor may refer you to an endocrinologist, who is a doctor who specializes in the treatment of hormonal problems. They may recommend hormone injections to bring your body's levels back to normal. And are there any other medicines for an enlarged prostate? Cialis 5 mg is the only medicine in its drug group called phosphodiesterase 5 inhibitors that treats an enlarged prostate. Other medicines that can be prescribed are 5-alpha reductase inhibitors such as finasteride or dutasteride, or alpha blockers such as tamsulosin or alfuzosin. If you would like to learn more about finasteride or tamsulosin, I will leave a link down below. Now, I hope you enjoyed this video, and please give it a thumbs up or leave a comment down below if you have any experience with Cialis you would like to share. You can also subscribe to videos that are released each week, or you could also check out some of my other videos or playlist. Thank you for watching.